Associate Professor Chrissy Fediora of the Griffith University School of Medicine, Gold Coast, Australia. I'm also the president and founder of the OCI Foundation, an international NGO that's been linked to the ArOY Youth Health Campaign, otherwise known as the ArOY Health Campaign. This is an OCI Foundation's initiative for Nigerian youths in the fight against breast and cervical cancers. Now, we've been running a number of modules that will help prepare our teachers ahead of the rollout of the ArOY Youth Health Campaign across all senior secondary schools in Nigeria. And this module, this particular one, it deals on breast cancer facts, which is a way of preparing our teachers and other participants on the knowledge they need to have in teaching breast cancers. So a number of outlines here. First, we're going to look at the relevant facts of this cancer in Nigeria. Then the survival facts, as well as the major risk factors for breast cancers. Then we're going to look at the major symptoms for the same cancer and then how to reduce the breast cancer deaths. And then there will be more practical tips on the prevention before we look at the screening measures for breast cancers. And then eventually we'll try to, work on some myths about this cancer and how to overcome them. There will be trial quizzes at the end, so please stay tuned to the end. And these quizzes are compulsory if you're going to get a certificate, particularly for teachers that will be working with us in this project. Now, they are very easy quizzes, so you don't have to worry about failing because there will be time to redo them. And then, there will be answers at the end before you even redo them. So we try to make it easy. We'll try to make sure you stay engaged with the program. Now, for everything we talk about here, it's been referenced, and this is the reference link to it. So let's start. So breast cancer facts, relevant facts in Nigeria. Breast cancers are cancers that affect the breast tissue. So it can also affect men. Anywhere there's a breast tissue, cancer can grow there. But then in men is only less than 1% of the cases. So very, very, very minimal, but it's still there. So don't be surprised if you hear that a man developed breast cancer. Around 571,000 global deaths happened from this cancer alone in 2015. That's over 500,000 deaths. Incidences from breast cancer has been on the rise. In 1960, 1 out of every 20 women would develop the cancer. At current levels, it is 1 out of every 8. So that's huge, a big increase, and it continues to increase. Now, it's usually more common in developed countries compared to Nigeria and other developing countries. But then in recent years, the occurrences in Nigeria are increasingly matching those from these developed countries, from Caucasian levels. A number of things account for this, but mainly from lifestyle changes. More of our women smoke. Many, because of schools, delay having their childbirth early. Many do not even breastfeed at all. Many use contraception. So all these things combine to increase the risk that we are seeing today in the Nigerian society. Unfortunately, even though we are matching the levels in Caucasian levels, our survival rate in Nigeria is much less compared to these Caucasian levels. Only 1 out of 10 women affected in Nigeria by breast cancer will survive. If there are 10 women with the cancer, only 1 will survive. Compare this to the numbers in the developed countries, about 7 out of every 10 will survive. So we are at a disadvantage, but then we are beginning to match their numbers. So we need to do something differently, particularly given that we have no government-sponsored screening, diagnostic, or treatment facilities in Nigeria. So in most of these other countries, they have systems in place where they get the treatments free, the screening free, and all that. We do not have them in Nigeria. So early screening and detection are vital to our fight in this cancer. Other relevant facts, age of mean presentation is about women in their mid-40s, early to mid-40s in Nigeria. Unfortunately, those under the age of 40 have very poor outcomes. The prognosis is very poor. In Nigeria, there's been cases reported from the ages of 16 to 96. So it can happen in the very young. And it's part of the reasons why we are targeting these young teenagers. Occurrences in Nigeria, about 12% of women aged at the age of 30 develop breast cancer. So this is very important to know. For those under the age of 25, you have these cases in about 3.3% of them. And those under the age of 20, nearly 1% get this cancer. So even though it's not common in the youth, it still happens. And the more we empower them, the better for everyone, particularly given that there are no other functional preventive programs in place in Nigeria. So early screening and detection, again, is vital. This has been repeated to make sure we drive home this point. And the OCI Foundation's ArOY Youth Health Campaign is the game changer. We've brought this home to every single Nigerian at the fingertip of your mobile, at your fingertips with the aid of your mobile phone, and if you're in school, free of charge. Now, survival facts. How do you survive this cancer? Keep in mind, if detected early, the rates can be up to 90%. So about 9 out of 10 will survive this cancer if it's picked up early. Problem is it doesn't. Now, the range, of course, is 85 to 95%. So the minimum that will survive to maximum that will survive. However, only 56% will survive if this cancer is diagnosed late. So this is important to know. If we do early, we'll fix it, or at least we get on top of it. If we don't, many will die, just like they're dying now. Now, among Nigerian women, about 7% see their doctor within 1 month of finding a breast lump or other symptoms. Just 7% see a doctor within 1 month. And 70% delay for at least 3 months before looking for help. So about 7 out of every 10 women will not see a doctor within 3 months of seeing a symptom. This is alarming. This is not good. And this is part of why the outcomes are so poor in Nigeria. Now, the main risk factors, what are the things that predispose one to getting this cancer? Being a woman, gender, women are about 100 times more likely to develop it than men. Age, the risk increases with age. So common among women in their 40s, that's already pointed out. Genetics, so family history. So unlike cervical cancer, where there is no family history linked to it, breast cancer is different. If anyone has in the family, there's a good chance of others having it. It can be hereditary. The genes responsible for it can be passed on. However, having said this, only about 10% of breast cancers can be inherited, can be found in a family history. The remaining 90% do not have a family history. So everyone needs to pay attention to this. Race is also another factor that can predispose to breast cancers. Caucasians, being white, poses higher risk than compared to being blacks. So this is important to know. A personal history, anyone who's had breast cancer before, there's a good chance of having it again. It puts the risk up. So other risk factors to know: early onset of menstrual period. So having your early period before the age of 11 can be a risk factor. Then late menopause, so the stoppage of menstruation before or after the age of 55 can also be a result. So basically anything that increases the duration of a woman's menstrual cycle or menstrual period in terms of the number of years it goes on puts up the risk. Not having children at all, we've mentioned this before, or having children after the age of 30. This is very common in our societies and explains why some of these cancers are going on. Not breastfeeding at all, possibly from work pressures or from kind of trying to look as beautiful as one can, and not breastfeeding puts up this risk. So breastfeeding sort of minimizes the risk. And taking the oral contraceptive pill, HRT, especially if given for more than 5 years, gaining a lot of weight in adulthood, especially after menopause, sedentary, where you don't involve in much physical activity and eating too much fat, drinking a lot of alcohol, put as 2 standard drinks a day, smoking. So all these things can increase your risk. So what about the symptoms? Symptoms that can indicate breast cancer: ulcer in the nipple, breast in the lump, lump in the axilla, that's the armpit, and nipple discharge from one breast only. So all this can put up a woman's risk. If you have them, see your doctor immediately. Skin dimpling around the breast. Now, others that are not suggestive of the cancer will be headaches, nipple discharge in a pregnant person, that's to be expected. Pain in the breast, it can be suggestive of cancer, but majority of the times pain in the breast do not indicate that. Chest pain is also another thing, and nipple discharge when it is being squeezed. So these things are not automatic, but they increase the risk. How do we reduce deaths from this cancer? Very important. There are 2 key ways to do that. These are through breast screening. So screening for breast cancers. Healthy education is another way. Unlike cervical cancers, there are no vaccines against breast cancer. So it has to be screening and healthy education, knowing that you know what to do, what to look out for, and how to take charge of your own health. Now we look at ways to reduce breast cancer. So we've talked about screening and healthy education. So first up is the screening. Breast cancer screening measures can be through breast imaging, through clinical breast examination, and through breast self-examination. We'll look at all these 3. So for breast imaging, it could be through X-rays, otherwise called mammography, or ultrasounds. You can do both depending on the age. Your doctor will guide you on this. Clinical breast examination requires a medical practitioner to examine the woman's breast. So a doctor usually does that, and usually in his clinic or in a hospital. So you rely on a doctor to do the test as against imaging where you get an X-ray or ultrasound. Also as against breast self-examination, which is where a woman does this on herself. It is simple, it is free, it is non-invasive, and it's a technique that can be practiced by virtually anyone, anywhere, but mainly in the closet of your rooms. The woman normally with BSc examines her own breast in her own privacy and schedule. It is a component of being breast aware, which will be described later. So breast awareness, being breast aware, is a kind of a holistic a term that has a holistic packaging that covers a number of things, and BSC is only part of it. Controversies exist though as to the efficacy of BSCs in reducing breast and cervical and breast cancer deaths. So is it really effective? Does it really reduce the deaths? Because evidence indicate that even though it may not directly reduce deaths, but when combined with other things like imaging, clinical breast examination, it can improve cancer outcomes by as much as 25%. This is very important to know. Now, in fact, part of why we approve and advocate for breast examination is that 80% of breast lumps and more than 50% of the deaths that accompany them are found by the women themselves. So checking them would help them pick these things up early. Therefore, BSC provides a layer of defense against dying from this cancer. And it is recommended by the OCI Foundation for Nigerian Women, particularly given that they have no real or alternative affordable programs in place. Now, the health education component, it's supposed to empower women to be breast aware. So we talked about being breast aware before, but health education helps them and empowers them to be breast aware. It's a very important part of the project, by teaching risk factors and early symptoms of breast cancers in schools or wherever. So that's part of what we expect our teachers to be doing. They also help with being breast aware, in addition to being taught about the risk factors and early symptoms. Also, we help with the technique to detect these symptoms. It includes knowing the risk factors, knowing the early symptoms, knowing the techniques to detect these cancers, being familiar with the normal appearances of one's own breasts, appearances and feelings, and knowing when to inform a doctor of any changes noticed in one's own breast. So these are all important parts of being breast aware. Knowing and practicing monthly BSCs, very important. And usually we advocate for this and we encourage everyone. We have a video. If you check our app, you'll see the video, practice it. A few more practicable preventive tips. Breast cancer causes are still not fully known, but the following can help minimize the risks. Do not smoke. Eat healthy, avoid high fatty food or sugary drinks, and eat up to 5 fruits of veggies or fruits a day. Very important. Increase physical activity. So this is defined, as moderate intensity activity, which is doing it for up to 30 minutes for 5 days a week. That will amount to 150 minutes a week. Now, what you'll find is not every exercise is acceptable, just enough, something that's strong enough to make you puff. That will be a bit of a guide as to what's the good exercise to do. Maintain a healthy body weight. BMI of 20 to 25 is ideal. BMI, you can Google it to find out what it means, but a healthy diet, a healthy weight. So avoid alcohol and then make BSC a part of your monthly routine. So this is free and this can be done by every woman practically everywhere. So this is very important in minimizing the risks. Once one attains the recommended age of screening, as we'll talk about soon, commence regular screening. We'll talk about the breast imaging, and we also talk about clinical breast examination. Important facts about BSC. So we've talked about this before, but for emphasis, we need to reiterate it. It does not necessarily reduce breast cancer deaths. Very important to know, but most lumps found may not be sinister. Also very important to know. But then by improving being breast aware, it increases one's chances of noticing dangerous changes as they arise. So for this reason, the OCI Foundation promotes BSCs. Now the screening, things to know. For women, it is for women between, so we have 3 categories of age groupings for screening. One for women between the ages of 20 and 30, then for those aged 40 or under, and then aged irrespective of your age, but for those with increased breast cancer risks. So we'll look at what's recommended for each of these groups. First of all, those aged between 20 to 39, monthly breast self-examination BSCs are very important. Do it monthly, and then clinical breast examination by a trained professional usually says every 1 to 3 years, but every 2 to 3 years would be ideal. So these are the 2 measures if you're between the ages of 20 to 39. If you're 40 or older, you still do the same thing, monthly breast self-exam, but then yearly clinical breast exam. You don't have to wait for 3 years, do it every year by a trained health professional, usually a doctor, and then every 2 years, go for a screening mammogram with or without ultrasound starting from the age of 40. Your doctor will guide you on this. This is very important. Now, irrespective of age, those with increased breast cancer risks they also have their own patterns. So you don't have to fall into the age brackets above, even if you're young. and you have a risk factor due to family or personal histories, discuss with your healthcare provider, because you most likely need to consider some of these screenings early on. And then you should consider more frequent. So you need to start them early and more frequently. Now, a number of myths need to be debunked. So very important we debunk these myths for Nigerians so that we can all be on the same page and we can all have the right approach and the right mindset to fight this. Family history is not the largest risk factor for breast cancer. So yes, there's a chance of that happening if you have a family history, but majority of the time it's not the case. In fact, only 8 of 9. So if you have 9 women, about 8 of them, are diagnosed with this cancer that have a family history. Using deodorants or antiperspirants do not increase your risk of this cancer. And trauma to your breast, a punch, a blow, or something like that does not increase the risk. However, some breast cancers can come to your attention because of trauma. So you might feel some lumps of snitches and ulcer because there's trauma to your breast, but the trauma itself does not trigger off this cancer. They are not caused by evil spirits. This is very important, and they're not caused by evil people or through black magic. And they are not punishments from God. So these are all very important things to note about breast cancers. This is the end of the presentation. Thank you very much for being part of it. Join us so that we can arm our youths, so that we can do that while they're young, do that for all of them, and do that right now. Let us do this for our families, for our states, and for our country. Thank you very much.